Is it worth traveling to go see a board certified NUCCA doctor? And what's the difference between a board certified NUCCA doctor and someone that isn't board certified or has gone through the level 1 candidacy or 2 candidacy? It's a frequent question that we get, and so I'd like to answer it in saying that really it has nothing to do with the doctor. And what I mean by that is it has to do with properly giving the patient the correction of their atlas subluxation complex that they need. And so the reason that if somebody says to me, who would you see in an area? I'm always going to be sending them to the highest skilled doctor I can find. What do I mean by that? Well, I don't want them to go somewhere, be cared for, and not have their problem properly addressed. What I want to make sure of is if I'm going to refer somebody somewhere, that they're going to get the highest quality of care from whoever's in a region. And frequently, I would actually recommend somebody drive further or fly further to see somebody that I know is more effectively going to be addressing the patient's problem. And so it's not that it's about just board certification, it's really about effective care for the patient, excellent care for the patient. And there are big differences in any group of doctors that's out there. You could look at orthopedists. There's going to be some that are better than others. You could look at dentists. There's some that have a higher skill set or specialized training than another. It's really the same thing with NUCCA doctors. And so frequently we have people who are saying, well, what's the difference? The difference really comes down to quality of care. It comes down to, do they actually have the capacity to discover what's wrong with you? Do they have the capacity to effectively image you? Do they have the capacity to effectively study what's going on inside of you? And then once they know what the problem is and they've imaged you, do they have the capacity to correct your problem? Those are the key components. And so the reason why we recommend someone would go a further distance is because we want to make sure that that patient has their problem properly addressed, not just going to somebody and having the person do something to them. What we want is to make sure that something wasn't just done, but the right thing was done in the most effective way for the patient.